Would a neck lift under local anesthetic give a good result on the jawline without a facelift?
Thank you for your question. You're asking if a neck lift under local anesthesia would give a significant result even without a facelift being done at the same time. Of course, you did not submit the question with the photo, but I can certainly help you understand how these procedures, what roles they have in helping people improve their jawline. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Face and neck lifting has been a very big part of my practice, and certainly there have been so many variations and evolutions, and one of the things that you can certainly get as many answers as you could possibly want is by asking groups of doctors who perform the surgery what's the best way to do it. So I'll share with you first some basic principles to help you understand how I think through when the patient comes and wants a, quote, neck lift. Very often when people look at themselves and they catch themselves on a side view or happen to catch themselves in a three-way mirror or have a photo taken, they notice extra skin under their neck. And so what they'll do is they'll do some kind of a mirror lifting. They'll either lift the face, lift the neck, or push back, and they'll say to me, "Doc, can you just get rid of this for me?" And what I try to help people understand is first understanding basic principles of facial aging. What is facial aging? Well, facial aging is two significant things. One is volume loss, loss of bone, muscle, fat, soft tissue. And then it's also sagging and descent. It's sagging and descent of the skin as well as the underlying muscular structure referred to as the SMAS, or superficial muscular aponeurotic system, and platysma. So that tissue also has to be addressed. So to differentiate a neck lift from a facelift, well, an isolated neck lift typically involves a combination of an incision that is right around in front of the earlobe and then behind the ear, and to whatever level the extension of the incision has to be in order to create a flap that pulls the neck back, as well as an incision under the chin to address either the platysma muscle or to do, as well as to maybe do liposuction or to do something called a platysmoplasty, or to do some kind of under the chin neck definition. So that's an isolated neck lift. Now, in my experience, one very important variable, of course, is in terms of evaluating a jawline, is to understand how much of the sagging of the skin is caused by the face descending and how much is due to loose tissue that's best addressed by directing the skin back and upward. So I would generally say that a face, to maximize the jawline and improve the angle of the neck, generally speaking, the same individual has a degree of facial descent, which means they would benefit from some type of facelift procedure. So the facelift, which elevates things more vertically, is then really takes, I think, the majority of the significant amount of skin, and then the neck lift, the area behind, will actually finish the rest. Now, one other major component of this is, of course, volume loss. So you have to also understand that even though things can be redraped and tightened, you still need volume to make up for loss and to maximize definition, such as in the cheekbone area and the jawline and the chin. Sometimes that's best handled by placement of like a chin implant or placement of fillers after the surgery. So as far as the local anesthesia question is concerned, facelifts can be done under local anesthesia. This is one of the things that I've always advocated from the very beginning, is that you can do full face and neck lift surgery with local anesthesia. In our practice, we typically do it with light sedation. We do it in our facilities that are certified by the Joint Commission, so that we get the benefits of the hospital level care in terms of protocol, process, sterility, etc., but at the same time the convenience of an office. But my point is that you really should get a better understanding, or a good understanding I should say, of what component of the jawline improves when you lift upwards, and don't lift too aggressively, just lift slightly, and how much works from lifting back. So generally speaking, I tend to recommend to my patients that you do a combination of a face and neck lift, or a lot of times just a facelift alone. So speak to your doctor if you have chosen one, or if you are evaluating your options, and learn about what choices they would recommend, and you can be prepared to get a lot of different opinions. So I hope that was helpful. I wish you the best of luck, and thank you for your question.